Good morning. Good morning. I'm trying to make sure you guys could hear me. So if you get in and you could hear me, comment because Facebook do so many things that make no sense to me. So I'm trying to make sure that you have a good experience. So let's see. Good morning. Good morning. Good morning. Trying to give you all a good experience with this Facebook Live thing. But of course, we usually have some form of issues. So far, I don't think we have any, but the only way for me to know this is if you guys let me know that you can hear me. I see, I don't know your first name, but it's a AB. You said hello. So AB, can you hear me? There's a delay. So even though you comment, just keep in mind that it may take a little time for me to see your response. While I'm doing the presentation, you guys, I won't be able to look at your comments. I won't be able to see it because I don't know how you go about doing that yet. I know that there's a few you joining. We want to give some people time to get on. I'm just trying to make sure you guys can hear me clearly. So if you can comment, go ahead and do so that I could see it. I'm trying to, okay, I could see comment from my phone. I'm not sure you pronounce your name, Yubani. Good morning. So for you guys that's on to watch this electrolyte class, can you hear me? And I'm looking down, I'm trying to look at my comments to see if there's anything else. I guess the comments are coming in slowly because all I see so far is hello. Just let me know, can you hear me also? Just comment yes. If you can hear me, comment. Okay, yes, Caroline, thank you, thank you, thank you. Not sure how long ago you put in that comment, but there's always a delay. There's always a delay whenever somebody, whenever we're doing a live stream type Facebook message. This is not from our phone. So when you do it from the computer, there's a delay. So whatever you're seeing, actually I said it probably a couple seconds prior to. So it's like a delay with your response. I see a few people come in, but it really is slow response. Good morning, Sonia. Good morning, Caroline. Good morning, Yubani, AB. I'm trying to see who else joined because we have like over, I think if we were up to 50 people who want to be a part of this. I hope they wake up. We have people in different time zones. For those of you in different time zones, like people in Nigeria, somebody inboxed me yesterday of a area that I've never heard of. So their time zone there is 6 o'clock. Okay, there she is. Is it starting? She's inboxing me. Let me say yes, that's the same person I'm talking about. Yes, get in the group. And all right, I'm also have to make sure I check to make sure nobody is requesting to join right now, because I know it's the time to start at 10:03. I won't delay too long, but I want to give them the opportunity to try to get on. So let's see if she's going to be able to. Join. She's on the page and not the actual group. Let me direct her. Oh, she got in. So let's see. Let's see if she's really in. Comment. Leah, if you can hear me, comment below the live stream. Just say that you are on, okay? Give me a second. I am ready. I got my slides ready to teach you guys, but let's just try to see if we could get some people, because some people don't know how to do Facebook Live. Just give them a little minutes. It's 10:05. We said we'll start at 10, but remember we have different time zones and stuff. So please just wait for them. All right, just give them a little bit to get on. Ah, she said she's in. Great. I wanted to make sure she's in because it's now, I think, 6 p.m. where she is living. And I know some of you guys are in a total different time zone, probably AM time zone, and trying to be on live. I really want to welcome you guys, because you don't have to do this, but that shows that you really want to pass your NCLEX. This is not something that I usually do. I do it now and then in the group, but I'm going to try to do a little more of this. My schedule is hectic, so I can't really say like every so-and-so time I'm going to do it. I can't do that because I don't like to disappoint. Okay, she don't know how to comment. That's okay. You don't have to comment. I know you in and you can hear me. So that's all I want to make sure. If you can't figure out how to comment, don't worry about it, because I don't, the last thing I want you to do, Leah, is to try to comment and then you kick yourself out of this. I don't want that to happen. Guys, I'm gonna jump to my other screen so that I could make sure nobody's trying to join the group. So give me a moment. Just look if I see anything here. Sometimes I don't even know how to navigate this because it's so confusing at times. Okay, I don't see any new people, so hopefully I'm not missing anybody. Okay. All right, good. All right, let me jump back over. All right, it's 10:07. We're giving them 3 minutes and we starting. 3 minutes, I think that's enough time to be on. So you guys are the blessed ones. You're gonna get it live. So if you have questions, type it in. I'll do my best to answer, but trust me, when I say I don't know how to navigate my phone, right? I'm looking at my phone for comments, and then I'm also looking at the screen. So, okay, wow, here goes. Let's see. I see somebody else comment. Okay, it was just like David and Bridget. Okay. All right, guys. Sinead, that's you. You're on. How are you, girl? I hope you're doing well. All right, what time is it? We got 2 minutes to go, so I'm going to start share my PowerPoint. And then I need you guys to let me know if you can see my PowerPoint, okay? Oops, didn't want to go there. All right. By now, you should be able to see my PowerPoint. So if you can still, I just need someone to let me know if you could see the PowerPoint clearly. Just said yes below. Remember, there is a little delay. I know there's a comment just came in, but I can't see it. I'll just wait for it to pop up. Oh, great. Thank you. I got the text faster than the comment on Facebook. Wow. All right, great. I could begin. Good morning, everybody. Good morning. This is awesome that I'm able to do this for you. I know my head is being cut off a little bit. Let me see if I could. I know you don't really care to see my head anyway. You want to see the PowerPoint. But let me just introduce myself. My name is Pam Manning, and I'm a nurse practitioner. I have a master's in nursing education. I've been teaching nursing now for probably about 5-6 years. I really love what I do. I work with students to help them pass NCLEX. I just written a book called Breakthrough Nursing Education. We're doing pre-ordering. If you order between now and next week, prior to it getting on Amazon, I could waive the shipping, but I can't say I'm going to waive no shipping for international people. We could talk and work out a shipping thing, like I'll walk to the post office and try to get you like a discounted shipping. But for the people in the continental US, it's waived until it gets on Amazon. Breakthrough Nursing Education. What this book is, it teaches you step by step how to break down questions, think critically, understand and select all that apply, encouraging you, trying to get you through. And it's also a workbook because I put some workbooks material in it. All right. So that's enough about me. We're going to move on into electrolyte. I want to teach you something. Whenever you're studying electrolyte or any other topic, you want to picture yourself. You want to picture about the topic. So let's say we're talking about potassium. You want to try to visualize it as best as possible, just so that you have a better a better way of analyzing it. Because a lot of people who try to memorize stuff, it don't really work for nursing, because nursing is more like a hands-on approach, but you need some of the content to go along with it so that you can critical think. All right, so we're going to move on into our objectives. I'm not going to read these objectives for you word for word, but what I want you to know is when I finish, I'm not going over all electrolyte, but I'm going to go over about these four that you see listed on the screen, the sodium, potassium, magnesium, and calcium. So my goal is for you to understand how does it affect you in your body and what you as a nurse need to be doing and looking for in response to your patient so that you don't drop the ball or say miss something that you need to do. Because when you go for the boards, they're going to give you questions that mimic real life situation. That's why I'm saying whenever you answering your questions, you want to say, try to picture a real life, put yourself into the motion, so that in that case, you can actually visualize what is going on with your patient, and therefore you'll have a better understanding. At the end of this, guys, if you think that I did a good job, please comment below, below the video. It's going to be up live. You can always go back and listen to it. Also invite some of your friends so that they can have this experience. I know I'm not so active in the group because I'm pretty busy, but I'm doing my best now to make it different so that you guys can have a better response in the group. All right, there's a lot of things you need to know about electrolyte, but you did them at schools and at your school, and I hope that you guys go back and refresh. But if I was to go through everything with electrolyte, we'll be here all day, and I refuse to sit here talking all day, okay? But I pulled the bits and pieces of it out that I think is very important for you to be successful on your board. All right, these are two topics that you guys should have at least the basics of, because you should have done chemistry. But this is how you'll find out how electrolytes work in your body. So if you understand cations and anions, you will know that some of the electrolytes in your body has a positive charge versus a negative charge. And that's how it regulates the water balance in your body, because you have the intrastitials and the extrastitials, or the intracellular or the extracellular. And there's electrolytes on both sides because it needs to be at a balance. So if you have one of them going too high and one of them going too low, then your water balance in your body is gonna be off track, and you might have too much water in your cells that could cause it to burst, or you may have too little water in your cells, which cause it to shrink. So either case, it can be a problem to your body. So depending on which electrolyte you're working with can cause worse damage to your organs, because each of them has different functions, which we're gonna go through. And this is not going to be a long presentation. I think I have probably about 40 slides. So I'm trying to get through within 30 minutes, I hope less, because electrolyte is not one of the fun topics to talk about. If you have me in some of my review of topics, you'll see that I engage in it really well, but some of it is not fun topic like this one. All right, because it's a lot of memorization. So the first topic we're talking about is sodium. Sodium. I know you can see when you have a deficient in sodium, it's called hyponatremia. Oh, sorry, my phone is talking and I'm trying to, sometimes these Samsung, they just have a mind of their own, and it got rid of my Facebook live screen, and I'm trying to get it back on it. Okay, give me a second. That's just the devil trying to interrupt you guys' review, but I'm gonna do my best to keep this standing so I could see if you. Oh, Leah, you lost me? Oh, girl, I don't know what I'm gonna do to help you back on. All you gotta do is go right back into your Facebook group and just click on the live video, and hopefully you will be able to get back on. All right, so sodium is one of those electrolytes that goes with potassium in your body, right? And how in the world my phone is making a sound? Oh, it's the Facebook. I'm sorry, guys. I get a lot of pop-up on Facebook, and because I'm on the computer and I'm logged in on Facebook, you may be hearing some pop-up from time to time. So please, I apologize up front. That's not my intention to have a whole bunch of noise going on. All right, so with sodium, sodium and potassium, they work together, right? So you're going to see on the other sides what happened when you have low sodium versus high sodium. So on none of your electrolyte, like I just previously explained to you, you want it to be too little or too low, because either direction where it's going, it can interfere with whatever function that electrolyte does in your body. So guys, I need you to think before I get to the next slides, what is your functions that of your sodium? What is your sodium doing in your body? When you study, you want to think, if I have some sodium in my body, what is going to happen to my organs? What is it going to do? You always want to know the normal. What is it intended to do in your body? Because we can't live without salt. We can't live without water, right? So because we cannot live without it, there must be some good that sodium can do to your body, right? Now, there's also bad that sodium can do, right? So you can have some bad response, but you got to have some good response from sodium. So while you're studying, I need you to always think of what is going to be happening to your body when you have the right amount of these electrolytes. Once you know what it is doing, the right amount, then you can know what damage can occur if you have way too much electrolyte, or whether it's sodium, potassium, calcium, magnesium, all right? You should also know the normal lab values. Now, I'm going to tell you something about this. If we have lab, say Quest Diagnostic and another lab, I can't even think of, lab ABC, right? And you do a sodium draw from Quest Diagnostic and you do a sodium from lab ABC, these lab range could be a little different. You don't want to be too technical. If you have the sodium starts at 135 and you saw a lab say 136, or well, let's go to the lower side, 134, that don't necessarily is bad, right? It depends on your lab. So you want to know which lab you're working with, but for the state board purposes, they ain't going to come that close. They're going to give you a little bit different, like higher or lower. They're not going to make it so close because they know, depending on the lab that it goes through, then you may have like a little off with the numbers. So in your head, you guys need to know what is your lab value for sodium. And I'm not going to give you all of them. I have them on the slides, but I kind of break them up because I want you to think in advance. What is the range for sodium? What is the range for potassium? And then I need you to just try to guess it. So sodium works in your body to regulate your fluids, right? Your water balance, right? So you want to watch for excess amount of water when you have like high sodium or deficit, okay? Or low water balance. So for instance, if you have an excess amount of water in your body, you want to think what's going to be happening physiologically in your body, right? You're going to have too much fluids in your body. So when you have too much fluids, what happens? Your blood pressure going to go up, right? It's going to affect you physiologic. So you want to think about your salt content. What is happening if I have too much salt? Even though we're on Hypo for low salt right now, I want you to still picture both of them. If you have too little salt in your body, what is happening? If you have too high salt in your body, try swallowing a whole spoon of salt. You're going to feel so thirsty. You're going to be drinking a whole lot of water, right? So now think of the reverse aspect of that. If you have low salt, that means you may have a whole lot of water in your body because it's going to dilute it. And that's why the concentration of sodium is no longer going to be there. So you as a nurse need to be watching for that. Watch for rapid weight gain. And again, that's because you have a whole lot of water. And remember now, the water is going to be transferred from where it's supposed to be normally in your body, when I was talking about intracell, extracell, stuff like that, right? Just like talking about osmosis, diffuses, and those, it's gonna affect it. Depends on which electrolyte you're talking about. Your water concentration is going to be different, depends on which part of the cell you are. You also want to think about muscle cramps. Some of you get muscle cramps in your sleep. You want to always think about that. What is happening while I'm having these imbalance with my electrolytes? So when my sodium is low, you want to think about that. Guys, I already spoke about this part, but I just want to refresh for some of you who just come on. I just wrote a book called Breakthrough Nursing Exams. So for those of you who are trying to pass the boards, this book, if you already passed the board, you could support it by sending it to somebody you know that need this. You could get it from my website. I'm not going to go through all of this. I just want to put it up so that you guys know. And you also could get me to help you tutor you guys. I've been doing that daily. So we on low sodium. One of the primary things you want to look for when you have sodium issues, low sodium issues, you want to think about headache, nausea, vomiting, muscle twitching, altered mental status. You're going to find confusion, right? Different kind of weakness, seizures. So that eventually could lead to coma. So what you want to do, if it's seizure precaution, you as a nurse need to be patted in the bed. If you check your lab value on your patient and it said that their sodium was like 125, you better be watching for some of these symptoms, right? You want to be watching for some of these symptoms. So this is what I mean by picturing what could be happening with your patient. You as nurse need to do something. So when it comes to your patient with this, there's mild case and there's severe case. So if it's mild, you want to be restricting fluid because you already have an imbalance with fluid going on, right? You have low sodium. IV fluids, you may want to increase PO meds, right? You also want your sodium intake. Treat for water excess and sodium loss. But in severe case, there's hypertonic solution that you can give to your patient. What is hypertonic solution? How do you know this? This is the part that's very tricky for students. How I remember it, this is what I did. If you think about it, all the other IV meds, you have like a zero come in front of a decimal, a point, like 0.45, 0.9%. So when you think of hypertonic solution, you want to think of a number itself, like not a fraction of a number, just a number like 3%, 5%. These are considered to be hypertonic solution. So this is what you will give for the patient, okay? And if they have too much fluids on them, you might want to give some Lasix to remove some of the fluids. And I leave the slides up a little bit so you could read it, you could take a picture of it, or you could go back and watch the video later and look back on it. So now we're going to talk about the reverse effect of high sodium, which I was kind of touching base on a little of that. If you had got it right, so the range is 135 to 145, yes, any number greater than 145 is considered hyponatremia. Hyponatremia, right? For high concentration of sodium in your body. So now you're talking about a patient who has what? What is the main thing that you will see in a patient who has hyponatremia? Anybody knows? You find that you have this patient that is thirsty because they are possibly dehydrated. I hope that's what you're thinking. Yes. If you have too much salt in your body, Really? You're not going to be needing a lot of water? You're going to be suffering for water, right? You're going to really need some water. So therefore, you as nurses see your patient keep asking you over and over and over for water. You should be trying to check that labs, because some people will come to work and forget to look at their labs, or they don't have time, so they don't look at their labs. That's another way. But you don't find them requesting for so much water until, say, their sodium is very low. I mean, very high, sorry. If their sodium is very high. So let's say, the cutoff is 145 and their sodium is like 157, 58, then they're going to be thirsty. They're going to find that now what's happening in your body, remember I tell you, picture it in your body, now your water, you don't have enough water in it. So think of a cup of, say, water with some salt. And think about it that you had half of it of salt and water was like, say, twice the amount of salt. Now, if you pull out the portion of that water that don't have salt in it, you're going to have only salt left into that cup. So it's going to be more concentrated, right? So you as a nurse got a picture. If you want to get questions like this correct, you want a picture what's really happening in your body when you have low water, right? Remember, we're talking about sodium is going to balance water in your body. So if you have low water in your body, you're going to have a whole lot of salt. Now try walking around with just salt up in your body. And now when you think of water in your body, remember now it's blood. It's not just water, it's blood, it's everything mixed together. But just think, if you have a whole lot of salt, it's going to make the blood viscous, like thick, right? So now your water ain't going to be moving from where it's supposed to be to the next part. Again, I hope you did read this slide already, read it already, because you see that thirst is one of your factors. But something I want to tell you, this affects the elderly. But again, in the elderly, you have dehydration on a norm because they can't sense thirst anymore. So with them, they may not be asking for water. So you want to be careful about those questions. So you always want to look at the age of your patient when you're answering a question. You always want to look at your age of your patient when you're answering questions. So now the elderly, you have this elderly patient, and this patient is not telling you they're thirsty, but you look at their labs and you notice their sodium level way above 145. Yeah, that right there is not good, because they're going to start having symptoms. So some of the things you want to watch for, this is something that I made up. I put it as get on your last nerve. You're going to find the L for low grade fever, A for agitation, S flushed, and T thirst. Okay? This is something you want to watch for. It's kind of subtle, but it can help you if you remember this. What you're going to do for your patient. Always need to know what you may not physically write the order because you're not a doctor, but you got to know this is what is need to be done. So you have so much salt in your body. What you want to do, fix that problem by diluting. Give some water, right? Give fluids. You could also give some diuretics. You want to always check their level of consciousness, see if they are alert, see if they are oriented, right? Fix the cause. This is what you want to do. Think about what can you do for your patient with electrolyte imbalance. Fix what causing the imbalance. So in this case, they're not drinking water, give them some water. Or is some other issues going on? That's where the doctor come in to fix that issue. So we're going to move on to potassium. Potassium is one of your biggest electrolyte that you're going to see on the board. And potassium is important mainly because of what it does to your body, how it works, right? Potassium increase excess or deficit can be a problem, just like as in sodium. Potassium is eliminated by your kidney, so your kidney need to be functioning. So people who kidney not functioning, what can happen is that your find that the kidney, the electrolyte become excess. If you find me like kind of struggle sometimes because I see my phone message from your chat comments popped up and I'm trying to read it while I'm talking about the same thing. And sometimes you can't multitask like that. I don't do that. I can't type while I'm talking to somebody because I'll talk everything that we type it talking about. But I know my sister, she'll be having a conversation with me and she typing and she have a full conversation with me and she typed exactly what she wants. I don't know how to separate that kind of thinking in my head, okay? So just bear with me. Okay, so back to potassium. The range of the normal potassium 3.5 to 5.0, however, I have seen it in Medscape listed up to 3.5 to 5.5. Again, different labs, different values. So you can't be so picky about it has to be 3.5 to 5.0. No. Do not make that get you confused. Now you got to use some type of wisdom to say, when is it going to be way too much? If it's pretty close to the actual number that you hear, then they may not be focusing so much on that lab value. Okay, so don't be so critical about it. You got to really think, if this lab say 3.5 to 5.0 and you see it say 3.5 to 5.4, do not make that get you off track when you're answering your question. So with potassium, you could see that the insulin in your body can also move potassium from the extracellular fluid into the intracellular fluids. Again, these are things you should try to understand. If you forget about what is intracellular, extracellular, osmosis, diffusion, and all of those things, go back and refresh on those. Because if you're struggling with this, that's what probably is limited to you. You have to be able to picture the cell, inside of the cell, outside of the cell. Because when the electrolyte is out of place or too much in one area than the other, it's going to affect your cells differently. Whether it's going to shrink it or whether it's going to make it burst. But fluids, it helps. Your electrolyte going to help, like sodium is going to help with your fluid. Well, in this case, potassium is also going to do another function in your body. You want to picture that by thinking, what area of my cell is potassium affecting, which in this case, it could be affecting your, who knows? Anybody know? Comment before I move on. This is really good to know. All right. The area of your cell that potassium affect. All right, so now we're going to talk about potassium being greater than 5.0, or if the lab say 5.5, whatever, but greater, right? Decreased renal excretion can do that. So if you're not eliminate like your kidney not working, then it's gonna keep it in, because when water go out, your potassium go out. So now your kidney not working, so now it stays in. So if you have it in, like patient who need the dialysis, man, you should see those potassium levels. Talking about some high numbers, we're talking 8, 10, like really high, right? So now you have your kidney not functioning. Then you have all these other stuff that could be causing it, like written there, DIG. So when you have digoxin, a patient with cardiac issues, and they're on digoxin, then what can happen? Oh yes, I see Marquita Cooper and RN said the art. So, but where specific on the art is that I'm referring to? Specifically, what's going to happen? That's what I'm talking about. Anyway, so you have like people abusing like potassium sparing diuretic like aldactone. If they take in aldactone, which is spiraculone, it's removing fluid, but it spares your potassium. So they don't want this potassium to go because that patient already has like borderline low potassium, but they have too much fluids already. So they need to get rid of some of the fluids. So the doctor has to think critically, and he had to say, okay, I can't just give Lasix, because if I give Lasix, the Lasix is going to remove it, the potassium and the water. But if I want to keep some of my potassium on my patient, I'm going to prescribe the spiraculone, which is aldactone, and now that patient won't lose any more of their potassium that would normally go. So in this case, that's the way that the doctor would be thinking. So you as nurse just need to know that a person on potassium sparing diuretic can also be having excess potassium. So you have to be checking their labs for potassium. And if you see a doctor has a patient on spiraculone and the doctor not asking to check for potassium, you as a nurse could ask your doctor, Doc, you have this patient on aldactone. Don't act like you know more than the doctor now. And then you just ask him, what is his rationale for not ordering like a potassium? And then they'll tell you, because sometimes they have other reasons for why they do things, and they may make some sense and tell you things that will help you in learning your material. Okay. So it's also, well, we talk about it caused by altered kidney function, but salt substitute is another big thing, guys. They may throw salt substitute on your test, and you may not even realize that, okay, this is something that actually can cause it, because it don't sound like anything to do with potassium, right? But salt substitute is also another cause of it. I put a strip in here because they like to throw stuff on you about strips. And I put a strips in here because potassium really affect their heart. And the answer is right here. For those of you who did not know, the first bullet on the page has your answer, what I was talking about. It affects your skeletal muscle, right? So think about this. If your potassium is gonna help, like it's gonna cause a problem if you have too much, and it's your muscles, you wanna think about your heart, mainly your heart, right? Because now if your heart start acting funky because you have too much potassium, that is not a good thing. So they're gonna ask you what area of your heart is affected. Now I'm seeing like one person giving me like a thumbs up. Y'all guys, y'all better give me some love. All right, I'm not going on. I need some love. This is not an easy topic to teach, you know. And it's my Saturday morning. Y'all come show me some love. Give me some love, give me some hearts, some laugh, whatever you want to give me. But I need some stuff moving. And I'm looking for it because I got a little delay in my on the thing, and I'm looking here and I'm waiting. I'm waiting. Yeah, I'm seeing something, but it looked like the same person popping up, but yet I see like 8 people on. Y'all just need to hit the button, man. Hit the button. Yeah, there they go. There they go. There they go. See, I know they'll have fun too. I'm not one of those boring teachers. I know you all had some boring teachers. I did too. I'm currently doing my doctorate, and Lord, oh Jesus, every day I say I want to quit. But no, I'm not a quitter. You're not a quitter either. You can do this. Thank you for the love. Okay, time to move on. So one of your most important thing that they're gonna show on your state board, if you get a question like this, is that peak T wave and the last bullet on the page, the shortened QT interval, the press ST, those kind of things. I'm gonna explain what that means so that now you could picture it, because reading it make no sense. So I'm gonna show you how to picture it. All right, you see the first one, it say, see my mouse? I hope you can see my mouse. It said peak T wave. Let's talk about what is a T wave. I pick a slide that has it very clear that you could see it. So you see right here, you see how it comes up? Peaked. What peaked mean? Pointy, right? So just imagine this crunched up together, like crushed up, and now it's pointy. That's peaked. So now the next one is said, depressed ST segment. So where is ST segment? Look right here. Do you notice normal? Always know your norm from here to here is flat, right? Now what is depressed? Dropped. So just think about this just dropping down. That's the depressed ST segment. Now another one they'll tell you is a wide QRS interval. QRS is from this little peak right here, and to right here. So they said this is going to be wide. So from here to here, just act like it's stretched further, like a PVC. If you know what a PVC is, if you don't know, you need to go back and look for my training thing I did on cardiac strips probably last week. It's in the group. Just scroll until you find it. I explained that to you. I didn't complete that because that's a class that I charge for. I charge $50 to teach that class. So I just give a preview, but it will help you understand what I'm talking about, and it can help you on your boards. So now you have this nurse. What is it that needs to be done? So in a mild case, you can Lasix, remove fluids, and this was for high potassium. Restrict foods. You need to know the types of food that you're doing. And in that food, it's like banana. I'm not going to go through all of them, but you need to know some foods, common food. They're not going to ask you some weird food that nobody ever hear about. High source of potassium food. K-exalate, you want to teach your patient about K-exalate. K-exalate is a little brown looking, it almost looked like pudding, but in a watery type container. And you give the patient, you want to tell the patient that they can have diarrhea. All right, you can tell the patient they may have diarrhea. You also want to have this in emergency case, calcium gluconate. So the goal of K-exalate is to remove the diuretic, want to increase fluids, but if you got to increase fluids, you want to check to see if the questions say, to you that the patient had renal issue. So if you see anything in your question that say renal issue, and you see an answer saying increase fluids, you want to say, wait a minute here. So you got to be careful on how the question is written, which is things like this I teach in my review. Insulin also is a big key to this. Remember how we talk about, insulin get stuff in the cell? Yes, that will work. So if you have a patient with a type 1 diabetic, you already know that this is going to be an issue because they don't have that insulin naturally. Okay, that's critical thinking, guys. So now we're on low potassium. If you like we showed before, 3.5, it could be less than 3.5. Once it's less than 3.5, it's termed hypokalemia. You want to know these terms. They love to throw them on it. Like they'll put it with phosphate and stuff to confuse you and all of that. Listen, hypokalemia is for potassium being low. And again, it will come out through excess fluid leaving the body. So diarrhea is a way that can cause it to leave your body, right? Lasix. Thyroid diuretics can also cause that to leave the body. GI loss. That's a big one. So if you can remember GI, you need to just think about it as what area of this body, what's happening in GI. So if you know that potassium comes out with fluids, that's lost, and you know a person have diarrhea, you know it's going to come out. What about suctioning? That can cause it, right? You're pulling out water out of them, right? Metabolic alkalosis is something that you may not be thinking, so you need to know it, because the boards will put something that you definitely ain't thinking of on the board, so you want to think about that. If they're on diuretics, you want to watch for the potassium levels. And I created this for you. These things don't never work for me when I'm studying, but there's people out there that it will work for. So this is section: skeletal muscle weakness, EKG changes, constipation, ileus, toxicity digitalis, irregular weak pulse, orthostatic hypertension, numbness. This is section. You want to watch for muscle weakness, cardiac dysrhythmia. On the slide, the T wave would be inverted, U wave, or PVCs. PVC is the QRS being wide. Your muscle, remember, is your muscle. So if the potassium normally causes contraction in the muscle, when you have no potassium, it's going to make it flabby, weak, right? Confusion and disorientation also. You want to increase dietary intake, oral potassium, IV potassium, change potassium sparing diuretic, and you want to monitor for the electrolyte changes. Most of your questions are going to come on electrolytes changes and the food. You want to know those very well. Administers potassium. This is a big one that they will throw at you on the test. They will put potassium IV piggyback, potassium IV push. They will put those things to trick you. Do not go into the test not knowing the difference between the two. IV piggyback is going to be abbreviated. Know it well. They will try to confuse you, not because you don't know that you're not supposed to push potassium because it's a lethal injection. That don't mean that they can't trick you, because they'll write it in a manner where it can mess you up. So you want to go look up the difference between IV push or IV piggyback. You want to know how it's written, how it's abbreviated, because you do not want that to confuse you. I recall my time going, oh my goodness. When I look at the word, how they abbreviate IV piggyback, I almost got it wrong, because the way it's written is like tricky if they put both of them together. So you want to know this well when you go in. You never, another thing with potassium burns. It burns badly. I always hate when I have to give potassium to the patients. Well, if the patients were mean, maybe I wouldn't be. I'm just kidding. I'm never mean into my patients, but it will burns their vein. So the pharmacy might, and say the doctor in the hospital, they may give you a bag, and on it may say KCl 20. It's mean it's diluted into a big bag of saline. So therefore, you put that on a pump, but you don't want that pump to be set high. It got to be slow run. Whoever said slow infusion, Mark, thank you, Marquita. Yes, listen, after having somebody on potassium, you know what's going on with their veins? It's going to be shot, man. It's going to be burned. So this is something you want to be thinking when you're studying. What's going on to that patient? So it's burning them. What can you do to stop that burning? These are the way you want to think. All right. So we're going to move on to magnesium, and we're almost at the end, I think. Because I think we only have magnesium and calcium remaining. So it helped with ATP, and if you remember ATP from, I think it was AMP, and the Krebs cycle and the stuff we hated, it helped with ATP. The role is in protein synthesis and carbohydrate metabolism. It helped with cardiovascular system function. It regulates muscle contraction. What you have to know with all of these electrolytes, they work hand to hand. They work with each other. How I remember the range of magnesium, I know it's one of the low number. Like, so even if I can't remember it, I know it's tiny. So I could guess my way through it if I couldn't remember it. You got to think critically like that. If you can't remember the value, you at least need to know this is a small number, okay? There is your number. So if you didn't get this, you need to know it. 1.5 to 2.5. It is the second most abundant intracellular fluid cation. Which one was the greatest abundant? Do you remember from the beginning? We talk about it. Guess. Type it in the chat for those of you who know how to do that. It helps with your neurofunctions. All right. It's term when you're trying to say it when it's a deficit, it's called hypomagnesiemia. I never even can say it. Or hypermagnesiemia. Oh, Jesus. Emia is for blood, by the way. And when you have too little, it can cause the neuromusculars to get excited. So you could have like spasm. When you get excited, what you do, you jump and you twitch, right? You twitch it, right? Just think about this. If you have too much magnesium, your muscle gonna be like dropping. You can't do all your jumping around, moving muscles, right? But when you have too little, oh yeah, just think of your muscles, anywhere you got muscles. So if you have muscles in your heart, what's going to be happening? It's going to be dancing, and it's called what? Arrhythmias. So your muscles going to be twitching, dancing, switching, dancing, right? So you got to picture where it affects the most, your cardiac muscles. All right. Something I want you to know about magnesium. In some hospitals, they say they have a protocol, and the protocol is magnesium and potassium protocol. So a protocol, what that is you as a nurse do not need to call the doctor to get an order to replace magnesium or potassium, because they have a protocol that said, if you look at your lab and you see that the potassium is at this level, then you need to do this. If the potassium is at, the magnesium is at this, or both of them, then you need to do this. So you as a nurse need to know that if that person magnesium need to be replaced, you got to check the creatinine level. You have to make sure that the kidney is functionable, because you do not want to get them to have too much magnesium. So make sure their kidney is functioning. And how you know if their kidney function? BUN and creatinine. You're going to look for that. See if you see any weirdness going on with their BUN and creatinine out of range. You may not know what's going on, but if you notice that their creatinine level is too high, you need to let the doctor know, and you got to document. You got to say you're not giving the magnesium because the creatinine level is this much. I called Dr. So-and-so, and the doctor's supposed to give you an order. Whatever the doctor say, you got to go back in and document it to say, call Dr. So-and-so per this creatinine level being so-and-so in a patient that requires magnesium. Doctor order so-and-so. You need to do that. Always document. That's how you cover your butt. And again, I have a book called Breakthrough Nursing. It will help you to break down questions. It will help you step by step how to critical think. It has a really cool way of answering select all that apply. It's $35. It's on my website, npexams.com. npexams.com. See it right here at the bottom. Also tutors. So if you need to do that, go on npexam.com. Invite a friend to join the group. I'm going to be doing more and more of these support type training on different topics. I already done a few. I'm not sure if you guys saw them, but I've been trying to do it, but I'm also in school right now for my doctorate. So it's kind of time consuming. So I have to manage my time, but I'm going to try to do this. Can't tell you every Saturday, but if I do, I like to do it on a weekend because that's when I'm really free. All right. But I do a lot of family things on the weekend, so I may not. The book is not on Amazon yet, Angel. Right now I'm waiving shipping. It's in pre-order status. I already got my book. Let me see if I could get it to show you. Aaron, could you come get my book, please, out my room? It's already, I got my copy. I'm looking in it. So I saw something that need to be corrected, which take 24 hours. So it's right on my bed. So I'm gonna waive shipping. So those of you who want to order the book early, you could get it on npexams.com for $35. I will send the shipping, pay the shipping cost, but I'm telling you, if you're international, I'm not doing your shipping costs because I don't know what it costs, depending on where you are, but I will go to the post office myself. There go the book. So I will, and this book has different things like workbook in the back, but it has a lot of step-by-step instruction. It's not a big book, so you don't have to worry about, oh, I have to go read another book. No, it's not like that, but it's stuff that can really help you. Trust me, it can help you. And it will help you in your everyday life. Even when you finish and you become a nurse, you will realize this is something that you can use from now to your future. So it takes literally a few days to get on Amazon after I get this corrected. So the moment I correct it, the moment it goes on Amazon, I am no longer doing free waiving the shipping. So if you order before, then yes, I will waive the shipping and I'll sign it. If you order through me, I'll give you my autograph and all of that nice, cool stuff. Package it cute for you and I'll ship it your way. So if you order on Amazon, on NP, like for nurse practitioner, npexams.com, then I will do all of that for you. Okay, we're almost finished. So we're in the low stage of magnesium. And remember, I described that for you. When you have low magnesium in your body, what happened to your muscle? Can you remember? I hope you can remember, because I did a nice little dance right here, right? Let's see. Let me go back 2 slides so I can show you. All right, there it goes again. So when you have low magnesium in your body, this is what happens. Spasm, your muscle, your neuromuscular muscular activities, it gets so excited. I'm excited, right? So if your nerves are excited, it's gonna be dancing. So this is what happening, right? In the low section, high-risk clients, chronic alcoholism. These are people who you will find that has this low magnesium, right? Sepsis, burns. Burns is a big one, guys. You want to go into the test knowing about burns, because they can throw that on you, and it's a one that can be tricky. Trying to find out how much % of your body and stuff like that. Remember, with burns, what's going on with your burns is your fluid shift. The water is going to pull out of the cell. It's going to move all over the place. And when the water is out of place, your electrolyte out of place. But this is what can happen with your magnesium being deficit because of burns and wound needing debridement. You want to watch for CNS, cardiovascular, GI issues, neuromuscular. So if you're thinking about CNS, altered level of consciousness, confusion, remember most old people get confused because of UTI. In this case, if they don't have UTI, you got to go down the list. What else can cause confusion in my patients? Magnesium, right? You see, they could trick you up with this. And if you don't think of something as simple as this, you can miss it. If it's your heart, what's going on? Tachycardia. So now on that strip, you're going to see fast QRS things coming up. Hypertension, EKG, we know that for a fact that's going to happen because some excitement going on, excitement dancing, right? So you get arrhythmias. But the stomach, you have different things going on in the stomach. So think GI. So all of your, when you answer your electrolyte questions, start thinking about systems, your systems, what's happening in your CNS, what happened in your cardiovascular, what's happening in your nerves, what happened in your GI system. So one of your neuromuscle is this, right? This is the main thing they're gonna test you on from here to here. They're gonna give you real life symptoms like you're doing someone blood pressure. You put the cuff on their right arm. They start having twitches in their thumb area, right? What causing this? You need to say, wait a minute here. That's not normal. Let me go check this patient labs. You look at their labs, they're giving you some values. When you're looking, and it could be a long list of things they give you, by the way. When you look at that labs value, you want to be thinking, which one of my labs can be causing a patient to have twitching by their thumb? Okay, but what about the patient who say to you, you know what? My eyelid just jumping, or my muscles up here, or by my lips. It don't have to be your cheek. It could be different facial muscle twitching. When you check the electrolyte, you could see that you have this problem going on. You got to do something. So you have the mild case, you replace some of their food source, right? Severe case, you're going to give them some mag sulfate. It could be by IV or it could be by IM. By the way, they don't be giving too many people IM anymore. Monitor for neurostatus, cardiac status, and safety. If you have too much magnesium, which is greater than 2.5, again, do not be so picky on the range of your number, but you don't want to go too far away either. It could be really close to 2.5. They're going to be okay with that. The problem don't occur until when you start getting too high. It's not a common condition, by the way, to have too much magnesium in your body. It's not common. Renal dysfunction is the most common cause. We talked about that. Renal failure, Addison disease, DKA, if it's not treated, can cause it. You want to watch for decreased neuromuscular activities, hypoactive DTRs, generalized weakness, occasion nausea and vomiting. You got to watch for that. Do something. Again, you want to increase their fluids in the renal function, loop diuretic if no response to fluids. You want to have calcium gluconate for if there's toxicity, dialysis. All right, so we're going to do calcium. Our final topic is calcium. Let's see what this is. Okay, so I have two people live in my classroom. So you guys gonna just stick around when I finish. So So you could get to talk to them if they don't try to jump off, because you know some people, they don't like to be seen, but just so you know, you're already being seen. And we at the end. All right, so calcium, you know what happened with your calcium is for your soft tissues, your bones, right? It works together with phosphorus. So when you see calcium, you should be seeing phosphorus for your bones and your teeth. It also, again, can cause muscle contraction. It can affect your muscle and your heart. Major function, transmission of nerve impulse, blood clotting factors, muscle contractions, vitamin D. Guys, y'all need to be responding in here. Let me know if this thing is helping you guys. Let me know if you need more of this. I had another chat going this week of the different topics that you want. I'm gonna do, I like cardiac. I'm a cardiac nurse, so I might do some other cardiac stuff on Facebook Live. But you need to comment below. Let me know if you like this, if you want more of this, stuff like that. Muscle contraction is like I was talking about. Calcium can cause that. You need vitamin D. They love to throw this on you. You need to have vitamin D. I wish these pop-up could stop right this minute on my Facebook, but I can't really help it. Oh, I saw that I just have another student join. Guys, for my students that join, we could probably do, oh no, I think I have a meeting after this. If I have time, I'll do a little training for my live students that's in the group. And when I say live student, I'm talking my student that came on direct the chat, which you guys gonna be able to see them and hear them in about 3 minutes. It requires vitamin D, parathyroid hormone. Let me tell you something about your parathyroids while I'm on it. Let's say you have a patient who had I'm going to use neck surgery, right? Because you know there's different things right here in your neck, right? So they had surgery, and you see your patient start swallowing. You want to look down there, and the answer may say use a pen light and look in their throat. They're not telling you something stupid. Yes, you want to look to see if there's blood dripping in the back of their throat. Okay, but with parathyroid, let's say you have a thyroid surgery, the little grape-like cluster looking thing on the back of your thyroid, that's your parathyroid. It regulates, it works along with your kidney to regulate the function, the amount of calcium in your body. So if you have issues or surgeries with that, then you know you could have deficit with your calcium in your body. Or if it's not functioning, like some tumor type stuff, you could have excess amount of calcium in your body. So again, you need to have vitamin D intake. So if they have low calcium, you want to have some vitamin D so that it works together for your bones and your teeth and your phosphorus, right? So parathyroid hormones draw the calcium from your bone. So it will pull out the calcium out your bone. Increasing low serum level of parathyroids, a way to remember it is that parathyroids pull, P for P. PP, it pulls the calcium out your bone, right? With high calcium level, calcitonin is released. So when you have a high amount of calcium, then you're gonna have some calcitonin release, right? By the thyroid. And now it inhibits calcium loss. So calcitonin is gonna prevent loss of calcium. So calcitonin keeps calcium. So P for parathyroid, it pulls calcitonin, CK, calcitonin, it keeps the calcium. Now you have low calcium, which is caused by inadequate intake, malabsorption, pancreatitis, thyroid of the parathyroid surgery, like I just explained to you, but loop diuretics can cause it. Low magnesium level can also cause low calcium level. You should remember the ranges less than 8.5. Again, for hypo, low calcium, nutritional deficiency or vitamin D deficiency can lead to this. Parathyroid deficiency by the parathyroid surgery. Children and elderly, in their diet, they usually have low, so you want to give them some. Bone cancer can definitely cause issues. Treatment of the prostate cancer, estrogen depletion can also lead to this. Blood transfusion may come on your test. Blood transfusion preserve blood with citrate, and this binds with calcium. So this word citrate, when the person get blood transfusion, it has citrate in the blood, and citrate binds with the calcium. And if it binds with the calcium, it can cause low calcium. How you know is some of the things we just went over. Tech, don't ever ask me to pronounce these two words because I always say them wrong. I'm not even going to act like I know how to say it. No, I never can pronounce these two things. But the C I use to represent the cheek. The C word for the cheek, but it's not just the cheek. It could be any area of your face. They will throw on your test above your eye, jumping. And you may be thinking, oh, that's not the C word. Yes, it is. If you see some low calcium and this is happening anywhere in the face, you better pick that as your answer. But if somebody doing blood pressure and their finger jumping, or even if they're not doing blood pressure and they having twitching in their hand, you want to think the T word, okay? Twitch, TT, twitching of your hands, especially during blood pressure. When you put the pressure cuff on and you blow it up, it can start having jumps in your hands or right here, okay? You want to watch for, again, neuromuscular, irritability, muscle twitching, fractures because calcium in the bone, at risk, right? And with digoxin, you could have the response. So dig supposed to increase contractility of the arc. You give the person some digoxin and it's just not doing what it's supposed to do. You better be checking some calcium level, okay? Just saying, check some levels. So calcium gluconate, again, if you see it say put some calcium gluconate at the bedside, yes, you better do that. And all these patients need to be on a cardiac monitor, right? So this patient will be on a med-surg tele floor or a telemetry floor, but some form of cardiac monitoring need to be happening at this time. So when you have excesses calcium, what's going on? This could happen because of some type of malignancies in your body. The parathyroid, remember I was telling you, it's just not working like a tumor, adenoma, cancerous cells. Then it's going to overproduce of calcium. It affects your skeletal muscle, so therefore skeletal calcium secretion in the bloodstream could occur because of like breast cancer. If a person is sitting in bed, this is a big one that you need to know. If they're not getting up and walking around after surgery, or say they go in the hospital, they can't move, this can also cause that. Osteoporosis, thank you for the heart, for the person who just popped that heart up for me. Thank you, thank you, thank you, because this is not an easy topic to teach. And you see, I'm trying to stay excited, and I'm not usually this boring, trust me. I'm a fun teacher. And this is one boring thing. But I know somebody said, I think it was a young man, I'm not sure who it was, that said that he needed electrolyte. And because he was the first one to respond, I said, you know what? I'm going to do electrolyte for him. Oh, check you out laughing at me, laughing with me, because, you know, I'm laughing too. I don't like teaching this. No. Y'all lucky y'all got this much out of me. Anyway, osteoporosis. is a big one too that you need to focus on, because osteoporosis has to do with bones, right? And calcium has to do with bones. These are how you want to picture yourself when you study, and stop rushing. You want to give yourself a 6-week plan, and you want to study daily minimum of 4 hours. You guys don't want to read y'all book. When people give y'all books to read, y'all don't want to read it. But trust me, paying all these money, I'm not paying nobody no money. Even though I'm asking you to pay me, you can do it on your own. I know some of you need the help, because even though you're there reading the book over and over and over and over, you still can't pass the test. It's not because you ain't doing what you're supposed to do. It's just because teachers never teach you how to break down questions. They never teach you step by step what does Maslow mean, and those critical thinking, and how to do select all. They never do that. So you there reading, studying everything. Some of you are studying too much things, by the way, just to say. But some of you doing this and still cannot pass. It's not because of you some of the time, because you're doing what you're supposed to do. But then there's some of you guys who are lazy, who refuse to read a book from the front to the back. Listen, man, after you fail the first time, you got to put your foot down and say, you know what? I'm going to read this book from the beginning to the back. And I'm going to do the questions. Well, I give you a plan when you sign up with me for my 6-week plan. And in my book, it has a plan in there with a recommended book in there that you could use, and it gives you step-by-step instruction. The problem is, even though you get that book, you may not follow it. So for the disciplined ones in the group who are already doing this, please get that book if you can't afford to pay me, and help yourself to pass, because it's not good, it's not fair for you to go through school and can't pass. Those of you that's in Nigeria, those of you who's international, who are already a nurse, you guys need to get the book. Find a way to get the book. And if you can get with me for once, then I will help teach you how to utilize that book, how to break down the question. That's what you need, because you're already a nurse. There's some nurses on here already. That's what you guys need. Anyway, this is probably my last slide. I'm not sure. Osteoporosis. I was talking about the calcium. It's a big deal because of bones. So again, I just went over this. I just went over that, and I'm going to jump on to my group. Where is my students? Let's see if I know how to do this. And I don't think I know how to do it. How do I get to the students? I am not sure how to jump on Facebook. Can you see the students? I don't know if y'all could see them. I don't think y'all could see them. They lucky. I don't think I could see them. So now I just complete, let me stop share that screen. All right, so they jump off the screen before I get off. Look at that. Oh no, it said I have. Oh, hey, Barbara. I see you're still on, Barbara. The other people jump off. Thank you, guys. I want to say thank you so much for watching. Comment below if you need to get more of this. Let me know, and I'll do it. And if you need my help, you just go on my website, elect to whichever plan you want. If you need something more, like you can't afford the ones I have, and you need like just one time with me, I got a way to do that too. For those of you who is international, it's hard because of your time zone, but like for Leah, who don't know how to comment, Leah, I got WhatsApp. If you need to pay me for an hour, I could work with you for an hour and teach you, but I suggest getting the book. My website is npexam.com. Let me just type it here for those of you who come back late and want the video. NP exams. Thank you so much for the love. Thank you so much for the love. When you go on the website, it's a little bit confusing. I'm trying to work on it to make it better, but I build it myself. So listen, I get some credit. Y'all should give me some credit to know that I built my own website. So I know it's kind of confusing, but trust me, I help nurse practitioner students with a test bank that I have also. So Y'all just give me some love to know that I build a website that y'all could go on and find my book. And then I could sign my book and send y'all the package with my book. Listen, if you buy through Amazon, you still got to pay for shipping. But my shipping is waived until it comes on Amazon, which it might comes on by a week time. For you, those of you, thank you for purchasing book. I already sold some book. Thank you so much. Y'all made my day for purchasing the book. Y'all have no idea how y'all blessed me from doing that. Even if it was one of you, I would have feel satisfied because I am not a big writer, but I know I have a lot to share. I know I could help so many people. So I wrote this book and I had somebody edit the book for me. And I think it's a pretty good book. So I really appreciate it. That's my thing to tell you that you can do anything in life, because if that is my area of weakness and I can go ahead and write me a book, I mean, it's a beauty at that. Where did I put the book? I was just showing y'all, but Lord, where did I put the book? I don't even know. I don't even know where I put the book now, but it's a beautiful book. The cover is on the website where y'all can see it. But I'm telling you, man, I'm telling you, for me to write a book, you all have no idea how accomplished that is. Because when you really weaken an area and you got so much to share and you're able to find a way to do it regardless of your weakness, it's the greatest accomplishment. And you guys can do it too, because if I did it, I am certain you can do it. Because some of you are strong writers and some of you got a book in you. The fact that you guys are failing so much to pass this test is a book that you got to write. Don't make your weakness be your failure in life. Find a way to overcome them. That is my message for you today. Show me some love, invite somebody, and comment on topics that you would like to see me cover. And I'll do my best to do it. But remember, I'm also in school for my doctorate, and I also tutor students during the week. So guys, thank you, thank you, thank you. And Barbara, thank you for joining me. And you guys have a wonderful day.